Good morning, good afternoon, good evening to everybody watching us live on Facebook, and a wonderful welcome to Miss Ritchie Johnson from America, from Texas.
Yeah.
It's such an honor to meet you virtually in person and to have you here. And I have your book with me. Where is it? So it's an honor to meet you.
Oh, thank you. It is a pleasure to be here this morning and afternoon and whatever time, wherever we are. It's just a great opportunity to be able to spread the awareness and educate others.
It is. Thank you. And a wonderful welcome and thank you to Andrina for joining me today. She is our lovely co-host. And everybody who doesn't know me, my name is Mwapa Miller, and I am the founder of Symptomatic Sickle Cell Trait Support and Information Group on Facebook. And I just wanted us to kind of keep these conversations going about sickle cell trait and complications in relation to having sickle cell trait. And so, Miss Ritchie, this has been a long time coming for me. It's a topic that it's devastating, but we need to know as a community, we need to know a lot more about. So I am going to let you do your introduction, because I think it's such an honor to have you here, and I don't want to take up too much more of your time. So ma'am, please go ahead.
Thank you again. It is such an honor to be here to share with you my son's story as he went through a diagnosis, renal medullary carcinoma. First of all, I am a registered nurse by profession, and coming into this world of creating awareness and establishing a foundation was truly, truly out of my comfort zone. I've always been a nurse. I love nursing. I am still working 2 days a week along with running the foundation. And I am the president and founder of the Ritchie Johnson Foundation, which was organized in memory of my son, Chris. Just give you a brief synopsis about Chris and our journey. Chris was 38 at the time of his diagnosis. He was diagnosed with renal medullary carcinoma, which is a rare kidney cancer that afflicts individuals with sickle cell trait. RAMC is one of the deadliest of all kidney cancers. Normally, it is not discovered or because a person is asymptomatic until full blown. By the time that it is discovered, and a lot of times it is discovered by accident, patient may go in or present to the emergency room for other reasons, and then the next thing they know, someone is telling them they have a tumor suspicious for cancer. And normally it is stage 4 at the time of diagnosis. So just to tell you a brief synopsis about Chris. Chris was an avid baseball, basketball, football player. He loved sports. He had gone to Southwest Texas State, where he was recruited, and then later to University of New Mexico. He played football there. That was his niche. He grew up being extremely competitive. He always had to win. Even he and his brother, still up until he passed, one was a Texan fan, one was a Dallas Cowboy fan. So you can only imagine the excitement in the house, and God forbid if Chris lost, but he was just a beautiful person with a great giving heart. And he had complained of back pain, I would say a couple of years prior to even going to get it checked per se. He finally did go to the physician, and they sent him to the chiropractor. They sent him to physical therapy. No one asked, do you have sickle cell trait? let us do a CT scan. None of this was done. So therefore, the pain kept becoming worse. And Chris was downtown at work. He worked in the oil and gas field, very prosperous. He was doing well, very successful. And he called me. I also worked downtown. And he told me that he had blood in his urine. And I said, well, that doesn't sound good. I said, I tell you what, I will just meet you in Sugar Land at the emergency room. And so, of course, he beat me there. You know, I told you that competitive drive in him, but of course he was concerned. So when I got to the emergency room, I was in the lobby. They had taken him to the back. And I'm only thinking, as a nurse, kidney infection, urinary tract infection. Okay, so they'll start him with a little few antibiotics and he would be fine. So he called me to the back. He said, I'm getting ready to go for a CT scan and then they'll let you in. When I came into the room, the doctor came in and said, well, we need to do another CT scan with a contrast because we saw something that was suspicious for cancer. I said, wow. So they took him back, and for sure enough, he had a 7-centimeter tumor in his right kidney. Just hearing the word cancer is devastating. I mean, you have cancer. No one wants to hear that. So we sat there and I couldn't speak and I couldn't believe it. And of course, Chris also sat there, you know, and I said, oh my God, I need to get myself together so I can help my son. So I called my oldest son and Chris had driven his car. So I left my car at the emergency room and I took Chris home. And of course, we got through those days giving him support. And he went into this diagnosis head on, like a warrior. He felt that he could beat this. He never laid around and wanted people to feel sorry for him. But he did look to me to help him as a mother, as a registered nurse. I also became his advocate. So we had the kidney removed, thinking that, you know, maybe he can take a little chemotherapy, he'll be fine. But once they got in there, they found that he had the adrenal glands were involved, the lymph nodes were involved, and everything was so metastasized that they couldn't even remove the lymph nodes or the adrenal gland. But they did remove his right kidney. So once again, we're thinking that chemotherapy, radiation, he would be fine. Not really knowing anything about renal medullary carcinoma because the diagnosis wasn't made until after the surgery. And they did the biopsy. So then we're traveling unknown territory. The physician, the oncologist there, he said, well, I'm not able to really treat you because I'm just a general oncologist and we need to get you to someone who's an expert in the field. And that's when we were referred to MD Anderson to see Dr. Nazar Tanier. But before then, we had difficulty gaining access to MD Anderson. Chris had United Healthcare. They said that it was a pre-existing condition and would not pay for his care. I said, wow, another barrier here that we have to face, hurdles that we have to jump. So finally, after a while, you know, talking to the insurance company and Dr. Tanier said, I want to see this young man anyway. So we got an appointment over at MD Anderson to go and see Dr. Tanier. The pain that Chris was in, it wasn't from the kidney surgery, it was from the tumors continuing to grow. We got in, And MD Anderson kept saying, no, we cannot see him. And Dr. Tenier said, this young man is in excruciating pain. I want him admitted. You work out the other issues with the insurance. That's how we got admitted to MD Anderson. They gave him 1 dose of chemotherapy then, and then he had 12 sessions of radiation, which did shrink his tumor, and the pain did decrease some. He ended up with an internal pain pump to help control the pain, which did help tremendously. Our journey began with outpatient chemotherapy. Chris would have his chemotherapy on Fridays. And then Saturday, he felt good. Sunday, we had a bout of nausea and vomiting. He wasn't able to eat. Just the smell of food made him sick. So needless to say, he began to lose weight, which he said, I could stand to lose some, you know. And so he began to lose weight somewhat, but then I had to ask that they at least hydrate him on Mondays and give him something for nausea, just so that he would be able to make it through to the next session of chemotherapy. He did fine. He would get out sometimes to walk around, but then he began to have neuropathy in his left leg. And so he would walk with a little limp, but it never did stop him. Chris, if you didn't know any better, you would think he was a picture of health. He looked great. He did not ever just look like someone that was dying, someone that didn't have any control of what was going on. Because as his mother, I was also his gatekeeper. I have so many titles on this 15-month journey. And his friends started calling me because I had to let them know that when you talk to Chris, don't talk about his cancer unless he wants to talk about it. It's important that you talk about the good times. And if he felt good and you wanted to come pick him up, do that. But he just kept going. He started his photography business, and it was a CJ photography. And then Chris is the one that made our logo, the CJ. He wanted to do that to put it on caps so that he could make money toward, you know, the co-pays and things like that. It was simply used as a fundraiser. And the C, and these were his initials, and the C was his arms, and then the J was his body, and the little dot up there around the C was his eyes, and it stood for standing strong while fighting with faith. And up until the very last minute, Chris handled this remarkably well. He did become a little bit anxious, but, you know, he said he even woke up, and this is the thing with Chris, he woke up and he said, Mama, I know I'm dying. He says, I lived my life. I lived a beautiful life. He was a world traveler. And he says, just take care of my daughter, who was 6 years old at the time. And I told him it was okay. I would be there. I would do whatever I needed to do, and how much I loved him. And he passed away peacefully on this, after 15 months of this journey. I can tell you that taking care of patients with cancer or any other illness, we do, and a lot of times we do without even thinking. Of course, being a nurse, I am compassionate for others. But what I didn't know, after 40 years of nursing, God was ultimately preparing me to take care of my son. And when it's a loved one, it's totally different. You go into a different mode. He would always tease me. He would say, "Oh, Mom," he said, "how long are you going to remain undercover?" Because I'll go into the hospitals and I won't say anything, but I'm watching, I'm observing. You're not going to just give my son anything. So even one day, I knew it was the correct antibiotic, but it was the wrong patient. And I said, "No, you don't do this." "Well, it's the same." I said, "That is a federal offense. You're not going to give my child someone else's medication." So these are the things that you have to look at. They do things not even thinking and thinking it's okay. But the 15-month journey, I have to say, I learned who my son was as an adult. Because when they grow up and leave us, you're not with them day in, day out. You see them progress as a child and grow up to be a young man, and then they leave home. I saw the other side of him. He was extremely knowledgeable. He was humble. And I was trying to figure out, when did he become CJ? I knew him as Chris. That's all I called him, Chris. We never called him Christopher, of course. And I told his dad that. "You're putting this Topher on the end of my child's name, and no one will ever call him Christopher." And we didn't. But I was really surprised. I said, "When did he become CJ?" We talked about it. While in college, he was still Chris. But once he graduated from college and got into the corporate world, he introduced himself as CJ. He was now CJ, and that's what his friends who didn't know him, that grew up with him, called him Chris, but the ones that he met in the corporate world called him CJ. So I could tell when the friendship began. But Chris had so many wonderful friends and people that just came out and did things for him without him asking. And that's a true friend. These friends still contact me to this day. And at his homegoing services, there were over 500 people there. It was just remarkable to see the love that was there. And it continues to this day. His birthday, his death, the day that he passed, Christmas, holidays, they always reach out. And it's just been remarkable. But starting the Chris C.J. Johnson Foundation was because of Chris. It wasn't me. My plan was to go back to nursing because I had spent 40 years then at the time in nursing, basically in obstetrics in the management area, which I did put my job on hold so that I could adequately care for my son. There was no way I could juggle the two, and he was my priority. So cancer not only affect the individual, but it affects the caregiver or the family members that are there trying to take care of him. And it's just amazing. He got to the point where he felt like I had to be there all the time. If I took my attention and spent toward my son's grandson, okay, fine, go on and take care of him. And I said, I see a little jealousy here, so we laughed about it. I said, Chris, you got all of my attention, because he would always laugh and say, my oldest son, I loved him more. And I said, well, buddy, you didn't have to get cancer for me to love you more. I love both of you the same. I said, and now you have me 101%. Are you happy? And I said, but you didn't have to go to this extreme. So we shared a few laughs. And at any rate, while he was receiving his treatments, he said, Mom, there's no information out here in the lobbies about kidney cancer. He said, and then my cancer, I can't find anything on it, of course, unless you surf the internet and all you hear are bad things. And I said, you're right. And he said, I want to create awareness. I said, well, Chris, you're undergoing treatment now. Let's stay focused on you. He said, but others need to know about this disease. He said, they shouldn't have to go through what I'm going through. He said, I was healthy, very healthy. And then here I am with cancer. He said, no one should have to go through this. Look at all the information out here about breast cancer. And then in October, we were getting treatments and all you saw were pink balloons, And I said, you're right. And so needless to say, he passed away before he could start the foundation. And I thought about it and I said, I don't know what I'm doing. I have to find some answers. I knew the name. I knew we need to be registered, but I don't know what I'm doing. I'm a nurse. I'm not a person to start a foundation, nor am I an advocate. In a sense, I knew I was, but not to just get out there and create awareness about a particular disease. Well, I tried to interview to go back to work and I didn't give it my best. And I didn't get hired, because I was still grieving. And I knew in the back of my mind, that's not what I wanted to do. And I'm sure my voice told that, portrayed that. So I got busy. And in November, we got the organization up. November 2012, we had the name and we were going through trying to get the 501c3. And then that April 2013, we became a 501c3 organization. And basically the purpose is to be able to help the REMC community and spread awareness, educate, and raise funds for research. So many people, and including our medical professionals, think that sickle cell trait is benign. The common denominator for renal medullary carcinoma is sickle cell trait. I am a trait carrier. My son, Chris, was a trait carrier. My mother, 96 years old, is a trait carrier. So in essence, yes, you can live a normal life. But what you need to know is that sickle cell trait is not as benign as one thinks. There are so many factors involved. People with sickle cell trait can have the same pain as someone with the disease. And then we have the physical exertion, football players collapsing on the field. They had sickle cell trait and they became dehydrated and they died. The same with the military. And then we have renal medullary carcinoma. Who would have thought? Who would have thought? So the work that we're all doing to raise awareness about sickle cell trait is essential. We have to continue this. Our government officials are not going to do it for us. The sickle cell disease community is not going to do it for us. We have to fight for ourselves. And what people don't really understand, sickle cell trait is the nucleus of all of this. Without sickle cell trait, you couldn't have sickle cell disease. So this is what people need to understand. Educate about the trait, the high altitudes when flying, traveling. I'll be 72 next week, and I'm now feeling more pain when I travel to high altitudes. I don't like water, but I'm trying my best to force it in me because I know that's important, very important. So needless to say, when we educate people about renal medullary carcinoma, we continue to also educate them about sickle cell trait. They go hand in hand. Renal medullary carcinoma was discovered in 1995. No one had taken time to research this cancer and educate others about this cancer. Why? Because it afflicted African Americans the most and people of color. I can remember even when Chris went in to see the doctor the first time, he says, we don't have any medication specifically for patients with renal medullary carcinoma, but we're going to be trying this and see if it works. I said, well, why hadn't you done some research? Well, it only affects a few people. We only see maybe 1 or 2 patients a month. And I looked at him and I said, you know, if that one patient was your child, would you think differently? And he just stood there. And then it was Chris who told him, when he came to tell Chris there were no other options for him while he was in ICU, Chris raised up and he looked at him and he said, you're a world-renowned physician here at MD Anderson. My daughter is 6 years old. I need you to save me so that I can see her graduate from high school. He felt defeated. And that's what it took to get the RAMC movement going. He felt defeated. He said, this young man is right. He also had a daughter about a year older than that at the time. And he said, I too would want to be around to see my daughter graduate from high school. So that's what really got it going. He became very supportive of the Ritchie Johnson Foundation. We started an RAMC Alliance where we had physicians and scientists from around the world coming together annually to discuss and try to understand the biology of renal medullary carcinoma. And why is it that this particular cancer affects some with sickle cell trait and some without? That question still remains unanswered, but research continues. We've had in 2018, we had 2 clinical trials that opened because of the awareness. And just recently this year, they opened another clinical trial. So they're working. Our patients now are living longer. We had a young man who's now 3 years out, cancer-free. So it didn't take that much time. It just needed someone to have an interest. And it is predicted, and I hope that I live this long, so I told them they need to do it sooner, that by 2040, RAMC will be completely eradicated. That means that they will be cancer-free. So why don't we look at sickle cell trait? Why don't we get out there and educate more? Have more in the medical curriculum than a 5-minute talk about sickle cell disease, not really about sickle cell trait. You know, we can stop sickle cell trait if we start educating everyone and everyone would get out there and know their status. That is so, so important that we know our status and that we have some type of genetic counseling before we marry someone that if we happen to fall in love with another person who has sickle cell trait. Personally, if I knew, I would have two options. If I knew someone and was dating someone with sickle cell trait, and I knew we were going to get married and have a family, I would think twice, honestly. It would either be we got married and didn't have any children, or I find someone else that didn't have sickle cell trait. I know that sounds a little selfish, but I don't want to risk having a child with sickle cell disease. I don't want that, and the things that go along with it. But I'm just happy that we've come as far as we have with our awareness efforts. I think we all still need to come together as one to have a louder voice. No man is an island, and we should not practice in silo. We have to come together as one. Talk to our legislators. Let's get some things done. Let's get some federal funding where we continue to educate and make sure people are tested so that they will know their status. We've come a long way, but I still think there's a lot of work in progress that we need to get done and get done soon. That's pretty much all that I have. I'm here to entertain any questions that anyone may have.
Thank you so much for that. That was absolutely amazing and also inspiring. So yeah, thank you. There are already some questions in the Facebook group. I just want to repeat or say out loud. If anybody has any questions, please just put it in the comments, and then we'll be able to ask the lovely Ritchie. Okay, so we have one question already, so I'm going to go forwards and ask it. Margaret, did you have something you wanted to say?
Yes. Thanks, Andrina. Yeah, I just, wow. I just wanted to just say, even though I've read Mama, I'm Tired, A Mother's Journey through her son's cancer battle with renal medullary carcinoma by Miss Ritchie Johnson, hearing it just kind of drives the message home. There's so much more to be done, because it's pain that, like Miss Ritchie said, the pain that someone with sickle cell trait can go through. And while some patients are benign and then some are symptomatic, like the reason why we started the Facebook support group that we have, it's just finding the links between why, there's so many questions as to why, if sickle cell trait has been around, if the research for the full-blown disease has been around for so long, for at least, over 100 years, why the trait hasn't been looked at, and there's pain and suffering, that people are needlessly going through because of this lack of information and lack of care, because a lot of times, from my experience, I've found a lack of care. And I just, wow, Miss Ritchie, I'm so proud of you for all the efforts that you are doing, to support not just your son, through his battle, but to support the families that you support globally. And I just think unified, we are stronger together, so much stronger. I just, wow, I have not many more words than this.
It is interesting because, people don't realize how many people are affected, by REMC, and to find out that, yes, we're a small organization, but we're the only organization that focus specifically on patients with renal medullary carcinoma. And we're in Greece, of course, the UK, Colombia, Canada, even Australia. and of course here in the United States. And having this group that we do have once a month is so refreshing, and it's led by peers, and they can see that they're not alone. And any patient that come to the Houston area, I will reach out to them. If I know you're here, I'm there with you. We have become a small knit family, so much love. We just had a gala last Saturday, and they even flew here for the gala. We had over 100 people there. It was just remarkable how loving this community is, and how important education is.
Thank you. And I agree, we really need to work together. Okay, so one of the questions we've had from the Facebook group is, RMC is a very rare complication of SCT. How does it relate to full-blown SCD, HBSS, and its variants?
Okay, normally renal medullary carcinoma, there have been just a few patients with sickle cell disease that has gotten, and I would say maybe one or two. And that's the thing that they're studying. Why is it that it's just patients with sickle cell trait? Now, there have been other patients with other hemoglobinopathies that didn't have. Now, with thalassemia and those different sickle cell diseases, they do not get RMC. They have not been a factor. Thalassemia has not been a factor in patients with RMC. However, there have been patients without trait that have been diagnosed with renal medullary carcinoma. So they're still studying the biology. Why is it basically sickle cell trait being the major factor for renal medullary carcinoma?
Sorry, I was on mute. Thank you for that. Is there anyone within the Zoom meeting that would like to ask any questions? No? Okay. And again, putting it out to Facebook, does anybody in the Facebook group, if you have any questions, please put it in the comments so, you know, they can be answered. Okay. Morape, do you have any questions?
Yeah, I've got a query about say patients with sickle cell trait, Mr. Ritchie, if they have there been any instances, say, for people who've had kidney problems with the trait to be more at risk to developing RMC? I've had paleo, I don't even know how to pronounce it properly, but pyelonephritis before, and I was told at the time I attended A&E that I could have gone into a coma, so it was good that I did. I almost ignored it, as I always ignored my crisis pains until I was just bedbound. Even when they were major, I ignored them and dealt with them at home because of the drilling that, oh, you don't suffer pain, and GPs just kind of fobbing my mom off ever since I was a child from the age of 5 growing up. So I always knew how to manage the best I could at home, even when I felt like I was going to die. But just having pyelonephritis, is that a risk factor?
I don't think it's strictly a risk factor, but it is something to look at. And, you know, we know those with sickle cell trait do have kidney issues. I used to have pyelonephritis all the time, not realizing why, you know, but no, it's not so much that if you have pyelonephritis that it's a factor, but what I think is important is that if you have sickle cell trait, it is important, I think, that you at least have your urine checked for blood annually. And we know the insurance don't want to pay for a CT scan, but personally, it wouldn't hurt. You know, unfortunately, there is no pre-screening for renal medullary carcinoma, but for certain, if you start having blood in your urine, you definitely need to make sure that you go get checked. I think the reason that some patients were diagnosed earlier and at that time maybe a stage 3 because they went in with another illness or concern, and then this was picked up by accident. And I think that is the major problem with renal medullary carcinoma is that it's misdiagnosed. And oftentimes time has elapsed. I think about Chris's case for a couple of years. He was having this back pain. And, I think if it had been caught earlier, maybe he would be here today. I don't know. But I do know that we need to come up with better screening for these patients. So I know the physicians are now looking at researching blood. They want to take blood from people with sickle cell trait without RAMC diagnosis, and the ones that have been diagnosed with RAMC, they're trying to do a comparative study to see if indeed people with sickle cell trait, they can draw blood and detect that they may have cancer. So those are some things that are in work, and hopefully they could detect it earlier, which would definitely improve the survival rate.
Wow. Are there any studies that they have going on, or that your foundation has going on possibly in the UK that we can? I mean, I'd be interested in helping. I'd provide my blood anytime if I can help.
I will definitely reach out to Dr. Masal because he is looking for those. I know he has the 100 patients that let you know that RMC is not as rare as one think. They see new patients, whereas it was 48 back in 2012. It's now they see through the year. So patients are consistently being diagnosed, and I will certainly share that with him. I know they have the Ricky Casey Trust Foundation over there, a young lady in the UK, Nicola, her husband is a firefighter and passed away from RMC. So I know she's doing some awareness over there. And patients are being, seems like to me, I meet a new patient at least every other week. There is a new patient that's being diagnosed with renal medullary carcinoma. And, they will reach from afar because if the patients can't come here, they will consult with any physician, wherever they are, as to the protocol. They won't be able to participate in the clinical trial, but at least they can follow the appropriate medical protocol from afar.
Thank you. Wow. I just typed in the chat that also just from what you'd said is meeting people more and more with having renal medullary carcinoma, RMC, yeah. From being told, oh, you can have a rare kidney cancer, but it's very, and they stress the word very, very rare. However, I've found, and this is in my mind, all I've thought is it's not that rare because I've met more people with RMC since I decided to share that I'm a symptomatic trait carrier. And I just thought, I'm being told when I'm accessing my GP that it's rare to suffer symptoms, but here I am suffering. Let me just go for it and tell the world I'm suffering. And is it just me? Am I the only one? And when I did that, I was shocked at how many people came back to me. And this is where this group was formed, and it was informal to support people. And now we're a global thing, and it's growing. We're growing and finding people with sickle cell trait and families who've suffered losses and are grieving through RMC. The effects of having it with sickle cell trait, it's not as rare, and that's something I kind of adopted that term in some of the discussions. I said, let's change the narrative because it's incorrect. The lack of research is devastating to so many of us, but I know that if my pain and our unified pains can prevent, others in future from suffering the devastation that we have and the pain that we have. And it isn't all doom and gloom, that feeling that we sometimes have, but like you said, we have become such a family. You meet someone with sickle cell trait, or someone who's suffered because of having, complications of having the trait, like yourself. And I feel like if I saw you, I would run to you and just embrace you physically, because I feel like we are family, though we're separated by the ocean and miles and thousands of miles apart, but we are family. And it's just that unification that we have, just because we know what the other goes through in some way or form. And it's just that sticks in my head. It's not rare. It's not as rare as people think. So yeah, that's all I just wanted to say now.
Thank you. Okay, so just firing it out again to Facebook. If anybody has any questions, please feel free to put it in the comments. I myself had a question as somebody who's, a member of the public that doesn't know so much about it. From the foundation, which has been going on, what year has the foundation been active?
We became active in November 2012. And it's been 10 years. We just celebrated our 10th year anniversary. And next year, we want you guys to join us for our 10th annual Keeping It Renal Run Walk. We do it virtually and in person. So we want you guys to get on board with us.
Okay.
That way we can get this awareness all over the UK and everywhere else we need to.
Yeah.
And it's so much fun that even when I wear my CJ shirt and they say CJ Foundation, well, what is that? It gives you an opportunity to stop and spread that awareness. And that's what it takes. You have to be visible. Everywhere I go, I'm the REMC lady. I'm going to have on a t-shirt or my CJ shirt, because I owe this to my son and so many others. We have to beat this thing. They have to see us for who we are. We're individuals. We're very professional people. They're making a difference. Most of these kids that have passed away are successful. We have to stop this thing in its track. And until we get the awareness out there where it needs to be, and eventually one day we're going to reach the right person where it can just explode. So this REMC movement will continue. And I'm just asking God to please give me just 20 more years just to see this thing eradicated, okay? So I seriously want you guys to join us.
What date is that?
It's on March the 26th. And
wow.
I know that a time difference, but we don't care. We'll carry it all day long. So we get those videos in, we get those pictures in, and you guys are even welcome to join in on our REMC support group just to see the compassion. I could send out that link to you. We meet on Tuesday. And I know it would be late your time, because it's normally 7 a.m. Central Time here, but we do have, we're starting meetings once every third Saturday or so. We're starting meeting where we meet in the mornings here, and then of course it's in the evening in the UK and other places.
Okay, that sounds absolutely amazing. It will definitely bring awareness. The second question I had, obviously the foundation's going for about 10 years. What have we learned from the research? What kind of significant information have we learned from the scientific research and from the groups and stuff?
Basically, they've noticed that they're missing that SMART B1, which is the protein inhibitor that's in your kidneys. So we're missing that. It's called INI. You probably have INI1 or SMART B. Protein is missing in patients that do have renal medullary carcinoma. And then the medulla at least requires a lot of oxygen. And so when your cells sickle, that decrease the oxygen flow through and you become hypoxic. So then those cells mutate in there, and that's what causes the cancer. Then they've also determined from research that high intensity exercise is also a factor of REMC. Now, I knew that before they did the research. I told them, because just based on majority of the patients, I didn't have any scientific data to prove it, but just talking to all the patients, they were all participants either in the military or type of sport activity. And you know, those coaches will work you and dehydrate you, not hydrate you. And I think that those are the two main factors there.
So just thinking about that, I think obviously the sickle cell trait is not taken as seriously as it should be by a lot of the medical profession. So could it be the case that because they're not taking it seriously and they're not giving those kind of people extra oxygen, could that be the reason why we're seeing a lot of people with SCT getting, you know, RMC?
Well, I'm not too sure if it's that, because it's only 1% of patients out of the 3 to 4 million that are diagnosed in the USA with sickle cell trait. So I just, that's something that they're studying too, is why is it that some patients with sickle cell trait get REMC and why is it that some don't? So that is something they're still trying to understand, the biology of this cancer.
Right. Morape, did you have a question?
Not really a question, just a link, just to kind of just stress the importance to anyone watching and listening, that definitely please get checked out if you do high intensity sports, because from experience with myself, I began having kidney issues and pain when I would do high intensity exercise, and I was a gym fanatic. I've gained quite a lot of weight since not being in the gym, so I'm the kind of person that needs a lot of, you know, I need a lot of exercise. I need to keep active, and I was, until I couldn't be anymore because this just wasn't told. And I think that's another thing that I think would help if the information was more out there. Just hydration and just moderate intensity exercise. Don't go overboard. If your body's tired, when you collapse, it's not good. You're in a state of potential hypoxia, or is it hypoxemia? I can't remember which one, but you know, low oxygen levels in the body. Sorry.
No, it is hypoxia. You're correct.
Yeah. Thank you, Miss Ritchie. I just, yeah, it's scary when you collapse. And then the thing is, coaches need, I think personal trainers, physical trainers, they need that information. They need to know it, because I remember I actually did a personal training course, and I collapsed and I couldn't get back up and I couldn't breathe. And I did go to the A&E department during trying to do an exam, a physical training exam, and I was dismissed. They sent me home, and it was just, it probably was a panic attack, but it wasn't. I've had panic attacks later, more often this last 2 years after going through having other complications from the major crisis. But just knowing knowing what I know now, I think I definitely would have done things so different and been even more aware of even the reason why I get so thirsty. I think one of these discussions would be amazing to have Dr. Pavlos Masul that you mentioned, or the doctor that you mentioned as well, because I think just to have the full I guess an educational session and have you with him, Mr. Ritchie, at some point in the future would be amazing. Just to do some teaching, that would be incredible.
That would be great. I know he's open to that. He will do anything. Not only is he intelligent, but he's a compassionate physician, and whatever it takes to get that education out there, he would be willing to do it.
Oh, wow.
Perfect. I'm quite conscious of time now, so I just did want to read some of the wonderful comments that have been made about you. One, Lewis, I'm not going to try to pronounce the surname here. So glad to listen to Ritchie Johnson. Chris was the very first voice of RMC movements. So, and Ayola has said, Mrs. Johnson is an amazing SET awareness advocate. I recall her interview with Sickle Cell News published a few years ago. Keep up the good work, Mum. So I just wanted to, make sure I put that your way. And finally, if I was somebody that either wanted to be part of the clinical trials or to hear more about RMC and the foundation, where do I need to go to? Give us the details.
KrisJohnsonFoundation.org.
Excellent. And just anybody that's interested can join the clinical trials and, get a bit more. Brilliant. And where can we get your book?
Well, just let me know. I have the books here now. They're no longer on Amazon, but I do have some copies here. If you email me at Ritchie@KrisJohnsonFoundation.org, I can make sure that you can get it.
Say that again for me one more time.
Ritchie@KrisJohnsonFoundation.org is my email address.
Excellent. Thank you so much. You've been absolutely amazing. Do you have any kind of last words that you would like to put out there?
Well, basically, as a nation, we must come together to win. Mm-hmm. Renal medullary carcinoma is our desire that it will become history long before 2030. So I would suggest that if you do not know your sickle cell trait status, please go out. It's a simple blood test. Get tested and know that we are here for you if indeed you have sickle cell trait or you're exhibiting any signs and symptoms of renal medullary carcinoma or any of the other illnesses that could come from sickle cell trait. We're here for you. Just reach out to us. We love everyone and we're here to make a difference in the world.
Thank you. I just had one quick question from one member of the audience. Why is your book no longer available on Amazon?
Good point. My publisher and I fell out. So basically, I think it was one copy. It is one copy on Amazon, and that's what happens when you withdraw from Amazon. They'll have one copy available, but that's the truth. My publisher and I had some odds against each other, so I decided to pull my book.
Okay, all right, that's good to know. Okay, Margaret, any last comments?
I just want to again just thank you for being an amazing moderator, Andrina, and Miss Ritchie. Thank you so much for being here with us today, so early in the morning, and I'm just so honored to meet you. And yeah, hopefully one day I get to meet you in person and throw my arms around you and just thank you in person. But we're together in this fight, and please, I'll definitely keep in touch and keep you posted on what we're doing this end as well. And yeah, I'm interested in the helping out with research. So we'll keep fighting this fight together. Thank you so much for all that you do and for the incredible person that you are.
Well, thank you. And it's been a pleasure meeting both of you. And you are not alone. We're here for you as well. I would love to get over to the UK. So yes. we're gonna make this work. We're gonna make it work. And I'm a hugger too, so.
Oh, good.
So it's great. Thank you.
Okay, so thank you to everyone that joined in the Zoom call, and thank you to everyone that was watching on Facebook. We'll see you again at the next one next month. Thank you.
Thank you.
Bye-bye.
Bye, everyone. Bye, Miss Ritchie.
Bye-bye. Take care.
Blessings for today.
Happy holidays.
Happy holidays. Bye, everyone.
Bye.